Welcome to my podcast. Today I'm going to talk another station, which is back pain. So it's one of the common station and one of the commonest complaint of any patient. So basically, you will introduce yourself and double check the patient name and date of birth. You will ask the patient, how can I help you today? What can I do for you? So basically the patient will tell you, I'm having back pain and it's affecting me. So tell him, can you tell me more about it? So you will just say, I'm having this back pain for since some time. So you will inquire, was it sudden, was it gradual? And you will ask if the patient can describe what sort of pain. Is it tingling? Is it sharp? Is it pulling? So I just need to know what sort of characteristic of the pain, and you'll ask the patient to point out at the exact location of the pain, and ask the patient in a scale from 1 to 10, whereby you can rate the pain, where 1 is the lowest and 10 is the maximum pain. And ask the patient what you were doing when you experienced this pain, and if you did anything to ease it, and which basically will just point out to the precipitating factor and relieving factor, and ask if the patient if the pain goes anywhere, like sciatica. So he might say, oh, the pain is just localized, or maybe it's going down below. And ask also if there's any association, like for instance, paresthesia in the perineal area, or if he is able to control basically his bowel and the urine. So that's one of the which could indicate a serious situation. So basically, you will ask also if there is any as I say, any incontinence or any retention. Also, you will ask if he had any history of trauma, or you're going to ask what sort of work they do. Maybe he left a heavy object, which could cause this pain. Usually it's muscular or slipped disc. You will ask also if the pain is dropping and if it's mainly in the tummy, and refer to the back, which could point to abdominal aorta. It's basically on older men. You will ask also if he had any heart racing or palpitation, or a history of for instance, constipation or thirst or any of that, which could point out to hypercalcemia and could point out to multiple myeloma. So it's basically mostly in elderly men as well. And you will ask if there is any bumps and lumps that the patient is aware of, and if there is any history of weight loss. And also you'll ask if the patient had any thought, what might be the reason for that pain, because in certain situations the patient might have some clues. When you finish with all of that, you will ask if there is any history of joint swelling, for instance, or skin problem or eye problem associated, or any fever, for instance, or sweating, which could point also to certain other situation, like for instance long-term TB, bot disease, and maybe it could be related to other diseases. If the patient says that I have low back pain and it's stiffness in the morning with some other associated symptoms like eye pain, so all of that could point out to certain specific diseases, as we all know. And then you will ask about if there is any history of past medical, you will ask about past medical history, if there is any known chronic diseases, or if there is any history of some medication that's been taken for a long term, like steroids, which could lead to, of course, osteoporosis and fracture vertebra. You will ask also about any non-allergy, family history, non-family history of any sort of disease. Of course, you're not going to forget about the smoking and the alcohol, because they could relate in one way or another. Don't forget about the red flag, as I mentioned, incontinence of the bowel or urinary retention, or any weakness, both legs or both legs sciatica, bilateral sciatica, I mean. And when you, basically ask it about all of that, you will, instruct the patient better to stay active, and maybe take painkiller, like, for instance, ibuprofen or paracetamol, but not to exceed the recommended dose. Also can use ice pack and wrapped in a towel to reduce just the pain. Sometimes also we can tell the patient to put hot water bottle and wrapped in a towel as well, to just release the stiffness and the muscle spasm. And the patient can do some stretches and some sort of exercise just to keep active. Also, if the patient does not feel any better, you will tell them you need to come back. There is certain other activity being advised here in the UK, like brisk walking, swimming, yoga, Pilates. All of that will improve the core muscle of the body. And you will also tell the patient, if your situation does not improve, you can get back if there is something doesn't seem right, or if there is increase in the symptom. Also, don't tell the patient that you need to take time off or stay in bed, because this is evidence-based medicine did not prove that this will improve the situation. So it's always better to keep active and keep moving. And just you need to give about the safety netting, as I mentioned early on, and you will just instruct to be active and treat just with the simple measures I just mentioned. And also you will refer, of course, to the musculoskeletal for physiotherapy if the case needed. And you can sign up for a support group with the same issue, just to help them each other about talking about the situation and how they manage to improve it or make things a little bit better. So by that, I hope that I covered the main points about back pain and how to approach it, and how you can manage the patient, and not to forget about the red flag and safety netting. Thank you.